Care Management Platform, screening patients for COVID-19. To assist with the current needs of practices as they start to reopen for non-emergency care, Care Management Platform can now track pre-appointment screenings of your patients. The screening form is conveniently available whenever you are managing appointments. To enable this feature, go to Administration, Scheduler, Schedule Settings. Check "This location screens patients" to provide access to the screening form when managing appointments. If you would like to be prompted to complete patient screenings when scheduling, rescheduling, or checking in appointments, check Prompt Users about screenings. If automatic prompting is not enabled, or if you elect to defer screening when prompted, you can click Screen Patient to complete a screening at any time. When scheduling an appointment, a message appears asking if you would like to screen now or don't screen. If don't screen is selected, a note is added to the appointment that the screening was skipped. Complete the patient screening form. The temperature can be left blank since the patient is not in the office at this time. The patient's date of birth is automatically used to determine if the patient is over 60 years old. If the patient is over 60, they are automatically flagged with a screening risk. Answering yes to any of the other screening questions will also result in flagging the patient with a screening risk. When done, save changes. If a screening risk is present, a message will appear suggesting that the appointment can be rescheduled to a later date. A check on the appointment tile indicates that the patient screening has been completed. Screening risks are also indicated on the appointment tile. Selecting the appointment gives further indication that the patient has a screening risk, and a COVID-19 icon is added if the patient has a recent screening risk. Select View Patient Screening Data to view the patient's latest screening form. A drop-down is available to access all previously saved screening forms for the patient. If a patient with a recorded screening risk is scheduled again within 3 weeks, a message automatically opens reminding you of the potential risk and provides you with the choice to proceed with the appointment or to schedule for a later date. You can quickly review the patient's screening forms from here as well. On the day of the appointment, you are prompted again to screen the patient when you select Check In. Now that the patient is at the office, you can record the patient's temperature in the screening form. Elevated temperatures will also automatically flag the patient with a screening risk. If a form has already been completed or if prompting is not enabled, but you would like to add the patient's temperature when they arrive, select Screen Patient from the appointment to access a new form to complete. Lastly, the clinical team can also review the patient's latest screening form by clicking on View Patient Screening Data from the side panel of the patient's hard tissue chart. This concludes Care Management Platform screening patients for COVID-19.